We're joined this morning by some very special guests with Greenwood Leflore Hospital, Dr. Roger Grivens and Mr. Wilson Gilliard. Welcome, gentlemen.
Good morning.
How are y'all today?
Great.
Doing great.
Well, good, and we're glad to have you guys. You guys are with the Cancer Center in Greenwood Leflore Hospital, correct?
That's correct.
What do you guys do over there, Doc?
Well, I'm a radiation oncologist, and so what I do is treat patients with cancer using radiation. We have a linear accelerator, and if we have time, I can explain a little bit more about what's entailed with that.
Absolutely.
But we treat patients that have various types of cancers, as well as a couple of benign conditions that we can actually use radiation sort of in a cosmetic way.
Now, you guys reach out not just to Greenwood, you reach out to a bigger area, correct?
Correct. We treat probably about a 50-mile radius. So we see folks from the Cleveland area, even as far north as Clarksdale, Grenada and Winona, and even over here to Greenville.
Cancer is a very serious thing, and it's a scary thing. What's coming to see you guys really going to do for patients, not just physically, but mentally, I guess?
Well, first of all, my approach is to educate the patient, and certainly it is a scary situation anytime there's a diagnosis, whether you're a lady or a gentleman. But oftentimes, a lot of these cancers are treatable and in many cases curable. And so educating the patient on their condition, letting them know what to expect as far as the treatment and what the success rate is really relieving to the patient, and it really relieves a lot of anxiety. Because certainly when people hear cancer, they automatically think death.
Right.
And that's really not the case in a lot of situations.
What, for those people that are out there that, they've had a fear, they've had, suggestions or whatever, what are some things that they should do now and, to make sure that they're doing the right things now to stay healthy?
Well, generally a healthy lifestyle, and certainly, see your local family physician. But a couple of things that I advise anybody. Avoid the use of tobacco products, smoking, chewing tobacco, that sort of thing. With it being summertime, one of the obvious things is avoiding the sun, or not necessarily avoiding the sun, but if you're going to be out, using sunscreen.
Absolutely.
Skin cancers, melanomas are common. I see a lot of farmers, a lot of people who were in tanning beds in their young age, and now they're developing these skin cancers. And then just a general active lifestyle and appropriate diet. Diet, exercise, maintaining your weight are all
Staying healthy.
Staying healthy,
right.
All falls into that same bucket.
Mr. Gilliard, now if some people are interested and they say, listen, I'm not sure, I want to just come in and get a checkup, how should they do that?
They can simply call us, 662-459-7133 or 800-720-8933. We'll be glad to help them any way we can.
And located at the Greenwood Leflore Hospital. Doc, one last question. If they do have that fear, if they are scared, maybe I do have something, how urgent is it that they come in and see you guys?
They should contact a physician, whether it's their family physician, or contact us as a resource to help direct them to the appropriate care. So anytime there's a suspicion, an abnormal mole or lump or bump, everybody should seek professional medical care.
And I think you said it best earlier. I mean, the big thing is to stay alert, to stay healthy. If you have something, to get it checked, but not be afraid that it's just going to be death.
That's right.
So,
that's right.
Fantastic. Thank you guys so much for being here. We really appreciate it.
Great.
Thank you.
Stay with us. Soon we're going to the kitchen to finish up this morning.
This Defeat Diabetes segment is brought to you by Greenwood Leflore Hospital.